everyone. Welcome to the Glow podcast. I am here today with a very exciting guest. I have Dr. Singh from Albuquerque, and we are super excited to kind of get into some questions about how healthcare has evolved. But before that, if you are new here, we are Tailored Marketing, and we help dermatologists and skincare clinics grow their businesses and increase their revenue through strategic marketing strategies. So if you're interested, drop a comment below. Dr. Singh, I'm so excited to have you here and kind of dive deeper into some different trends kind of going on within the healthcare industry and dermatology too, of course. If you could, I would love for you to just kind of introduce yourself so my listeners know who you are.
Thanks so much for having me. I'm Dr. Singh. I'm a board-certified dermatologist. I graduated medical school in 2008. I graduated residency in 2012. And I've practiced in a variety of settings, from small private practice to multi-specialty medical group, even in academic hospital settings. So I've seen healthcare from a variety of perspectives. I've also seen dermatology evolve over the last 10 years. And so we've seen the scope of practice kind of change, and access to dermatological care has also been very challenging for many patients. So I'm excited to have this conversation and help your viewers kind of navigate all those changes.
Yeah, no, that's super, super cool. And so I am so interested, like, what kind of inspired you to get into dermatology to begin with?
Sure, I had acne as a teenager, and so I was always very drawn to it. When I was in medical school, I found that I was more drawn to people who were really motivated. And dermatology patients are the most motivated. They have something that they can visibly see, and they take what you say very seriously. And rather than trying to convince people of what was good for their health, I think just kind of having a good partner from the jump was really exciting. And, dermatology covers all aspects of human health. I have some patients who are 6 weeks old. I have other patients who are 99 years old. And I do a combination of medical, surgical, cosmetic, integrative, and pediatric dermatology. And so that keeps my office life very interesting. And it allows me to kind of do translational services for patients. They come in with their skin producing a signal or producing some sort of commentary on what their internal state is, and I can kind of do translation for them and say, your skin is producing this because fill in the blank, and then we're off to the races to look for solutions as to how we can make them better.
Yeah, no, I agree with you too. Dermatology is one thing that you can definitely see when something's getting better, and a lot of things too. I mean, you may be able to feel it, but it's very in front of your face, like you can look in the mirror and be like this is getting better or it's getting worse, or like I didn't eat very well yesterday and now I'm breaking out.
Yes, exactly.
So yeah, no, that's super, super cool. And so now I know you have a dermatology practice near Albuquerque, New Mexico. And so what kind of inspired you on this path to opening your new practice?
It was a circuitous route. I wouldn't say that there was one thing that inspired me. I graduated residency, and I had kind of always been under somebody's thumb. Medical training is it's adaptive to not have a preference to anything and to roll with whatever everybody else wants. And so I didn't really even know what I wanted. And suddenly after training, that's very maladaptive. And so I went through a variety of different workplaces, kind of not being fulfilled and seeing the healthcare system overall deteriorate over that time. And kind of feeling this need to extract myself out of the dysfunction. I landed in Albuquerque, New Mexico, even though I was born and raised in the Northeast. I kind of needed the polar opposite of that. I needed to be in the Southwest. I've never lived in a place that's so easy to live in, and that also has like a low cost of living and just kind of a smoother pace of life, I would say. And so that has helped me personally a lot. And since being here, I've worked both in academic settings and in multi-specialty medical groups. And I found that being in private practice is kind of the right setting for me to be able to deliver high quality care and to help people understand that the cure is possible. I think a lot of times with chronic diseases, it's just kind of like, how do we manage this chronic disease? And not how do we
Yeah.
listen to what the chronic disease is telling us, and then transform ourselves so that we can kind of get out of it, find a path out of that illness. Because otherwise, I think what routine medical care tells us is that you have this chronic illness, take this medication, and you'll be ill for the rest of your life. But this medication will just kind of keep you sick and suffering, but maybe not as bad. And I think when you put it
Yeah.
that way, a lot of patients are like, I would rather do the work up front of changing my body and listening to what it's telling me so that the next illness doesn't come and the next illness doesn't come. And so that's kind of the sweet spot that I find myself in.
Yeah, no, and I think that's such a great approach. It is really easy for people to just take a pill and they're relying on that pill or, whatever it is, any certain sort of treatment. But it's a lot of people would rather do the work up front, like you said, to prevent it or make it better. And maybe it's a harder path, but the longevity portion of it is also important for a lot of people. And I think people are beginning to see more importance with that aspect of their health. And so you talked a little bit earlier too about kind of a little bit of the dysfunction in healthcare, as you put it. And I think that is probably a good way to put it. And so you were talking about with healthcare, I think you used the word dysfunctional, which is a great word to use for it, how it's kind of, you watch the evolution of this happen firsthand, and you've been in the industry now for 10 years. So how has it kind of evolved from a healthcare perspective and also on the dermatological side as well?
That's a great question. There are many different components to it. The first piece is going to be reimbursement. From 2001 until 2023, reimbursement for outpatient physician codes and payments decreased 26% when adjusted for inflation. And just to give you an example of other parts of, like, for example, Medicare, the largest payer in the United States, payments to outpatient hospitals kept pace with inflation. Patient for inpatient hospital stays kept pace with inflation. For pharmaceuticals, kept pace with inflation. And also for nursing home care, also kept pace with inflation. So it kind of tells you like who has good lobbies and who doesn't. But,
Yeah.
you know, most Americans receive healthcare in outpatient settings. And so they could certainly see the quality decrease when you're seeing the reimbursement and kind of all of the structural issues play out. In preparation for this podcast, I was wondering, well, what happened in the last 2 years if we add in from 2023 until now? Actually,
Yeah.
payments are down 33% when adjusted for inflation.
Wow.
Medicare has something called the A, the sustainable growth rate, but B, the conversion factor. And so the conversion factor is what is supposed to make sure that payments keep up with inflation. But looking at the conversion factor, it is set at where it was in 1997. So we're looking at almost 30 years of kind of loss of these programs keeping up with inflation. And just to put it in a very like everyday perspective, if you were to call a plumber to your home and try to pay them 1997 rates, you would not get very good service. Same is
Yeah.
true for trying to get your car repaired. Same is true if you went out to a restaurant, and same is true if you went to the grocery store. And so I think that people across the country are seeing the kind of disintegration of the healthcare system because it's just stretched too thin.
Yeah. No, and I know, like, I mean, you said it so well with comparing it to something like going to the grocery store. Like, if you looked at the price of, like, say, a common good, like bread, eggs, milk, compared 1997 to what it is now, if people were expecting the same prices, like, obviously you're not going to be able to get that, but when you think of something like healthcare, it's much more complex, so it doesn't seem as simple, but when you compare it to something like that, it puts it really into perspective for people of like what is going on.
And there's a reason for it. So we have extractive industries. You look at the largest healthcare player in the United States is United Healthcare. They last year had over $400 billion in revenue, 400
Yeah.
billion with a B. That's like the gross domestic product of large countries like
Yeah, it's
Malaysia and Hong
crazy.
Kong. And it's really nuts. In 2024, they went through something called the Change Healthcare hack. One of their subsidiaries didn't have two-factor authentication on and got hacked, and it caused a major disruption for everybody in the healthcare space.
Wow.
And you know, it goes to show you that when there is a profit motive in healthcare, every single step of the process becomes a potential profit center. And that is just added complexity in the United healthcare system that does not, sorry, in the healthcare system of the United States, but United Healthcare kind of does control a large part of the healthcare system of the United States. And
Yeah.
so it's understandable that when extraction of profit is largely at play, that some people will kind of not be affected by that, but other people will be very affected by that.
Yeah. No, and I feel like we see that, I mean, across all industries in the United States, but then when you think of something as personal and as important to everyone's livelihood, like you can't live without healthcare, you think it would take a back seat, but it doesn't.
Yeah, and it's so intersectional. The same people who are making policy are also the ones making agricultural and food policy, are
Yeah.
also the same ones, who are lobbied by pharmaceutical companies. And so there's so many different industries at play and they all intersect in our health. And that's why, more so than looking at us as having a healthcare crisis in the last 10 to 15 years, I would just say that we're having a health crisis in the last 10 to 15 years because
Yeah.
people are getting sicker. There's just that's objectively true, and we have a lot of data to prove that. And physicians are doing their best to try to help people as best they can, but the appointments are getting squeezed shorter and shorter from 30 minutes to 20 minutes to 15 minutes to 10 minutes. And
Yeah.
trying to fix that in less and less time, at some point, the system breaks down.
Yeah, no, for sure. And so I know that your current practice doesn't work with insurance. Is that kind of the reason that you've made this switch from not accepting insurance, is because it's not necessarily beneficial for the practitioner or the patient, even really?
So my practice, I don't contract with any commercial insurers. So that's true. I don't take commercial insurance. Now, do I have a lot of patients who have commercial insurance? Absolutely. They come in, and if they want a receipt to get reimbursed from their HSA or FSA, we do that for them. Or if they try to get reimbursement from their insurance, we try to do that for them. Or if they know that they have a very high deductible, the average deductible in America is $1,800 a year, which you're
Yeah.
not going to hit on one dermatology visit, much less like six.
Yeah.
But if you have a bronze plan off of one of the exchanges, the average deductible for that is $7,200 a year. And so they know that they just kind of have that coverage, A, for like legal purposes, and B, that if something catastrophic happened, but they don't rely on it on day to day. And so I have a lot of patients in my practice who are like that. I actually do contract with Medicare. And so
Okay.
when I opened, I was a participating contractor with Medicare due to the Change Healthcare hack, which we just talked about, and a variety of other things that we can get into. I made the election at the end of last year to become non-participating in Medicare. And what that means is that I can recoup some of the fees that have been cut and that I can charge up to 115% of Medicare. And so that offsets that 33% that we were talking about. By about half, so not fully. It also allows me to collect on day of service, and that greatly decreases my administrative burden because all bills are paid day of service, and then we submit the claims for the patients and they get reimbursed. And that, as a workflow, has really helped us a lot. I would say, by and large, the patients who were seeing me in 2024 are still seeing me in 2025, and we still have
Yeah.
new patients coming in. There is maybe 5 to 10% leakage where we'll get a referral and a patient will not want to see a non-participating physician, or a patient who saw me last year will say, well, no, I'm going to go see somebody else. That's entirely understandable.
Yeah.
But these are the realities of healthcare economics in 2025.
Yeah, no, definitely. I mean, insurance is so complex, healthcare is so complex, but like with insurance being such a large of healthcare for your average patient, because your average patient who's coming to visit like doesn't have the amount of money to fork over for maybe even like a single visit that they're coming to. What are kind of some of the misconceptions that you think patients have about insurance in general, or maybe not using insurance or direct to pay practices as well?
Yeah, when you were asking your question, I was reminded of the Michael Moore documentary that was like probably 20 years old at this point. And he followed people who had insurance and, in spite of having medical insurance, still went bankrupt. We
Yeah.
think about, oh, just get insurance and you'll be fine. And, it's only people who don't have insurance who are having issues. And that's an entire misconception that I think still exists to this day. There are a lot of patients in my practice who have no insurance at all,
Yeah.
and they find the rates that we charge to be very reasonable. What they're paying for a visit is less than what they would be paying for monthly premiums in any of the exchange plans, so
Yeah, I
that they
believe
actually
that.
get access to care and that they're not dealing with insurance. I have a fair number of patients who just want access, regardless of what type of insurance they have. They call around and they try to go through their insurance, and they find that either other offices in town or the university is not taking their insurance at all, or are not taking new patients at all, or if they are taking their insurance and they are taking new patients, the next available appointment is 9 months from now. And so they want access. And so that makes up a large proportion of the patients in my practice who value access to care and the peace of mind that comes with that.
Yeah, no, definitely. I feel like that's like the most important thing. And it's so interesting to me when like I hear about practices that you have to wait 9 months out, and it's like, what if you have like something serious going on where you need to see somebody and you are paying, for your health insurance or whatever, and you're not even able to see anyone. So it's like, what's the what's the
What's the
point?
point? Absolutely.
Yeah.
From the time that I opened my practice, I tried to make it so that we would have at least one new patient open slot available within a 2 week span.
Yeah.
Sometimes we have patients who cancel and we offer same day availability, and the patients are absolutely stunned because they've called around to so many different offices, and it's like, we can get you in 9 months, we can get you in a year, or we can't get you in at all. And then they call us and we're like, we can get you in tomorrow, we just had a cancellation. And they're just
Yeah.
gobsmacked by that. So I think that the value add for patients is clearly there. Also, many times patients want things that are never going to be covered by their insurance. Like they want skin tag removal or elective seborrheic keratosis removal or elective mole removal. And like that's not medically necessary care. So you can't even bill that to an insurance anyway. So why
Yeah.
not just get it done and pay for it and be done with it, rather than waiting 9 months to be told that your insurance doesn't cover elective services?
Yeah, no, definitely. And kind of switching to a little bit of another topic off of insurance too. So, one of the things that I really loved when I was looking into your practice is the really integrative approach that you have for your patients. And so, can you explain how different things within really our lifestyle, diet, inflammation, and our gut health affect also our skin health and our dermatological needs as well?
Absolutely. I think that that's one of the benefits of being direct pay. I have the time to go through this with each and every patient who needs it.
Yeah.
And we take both an outside in approach and an inside out approach. Just to take the disease state of psoriasis, for example, someone could come in with psoriasis and need to be put on a biologic medication. That would be a medication you see like a television ad for example, because their whole body is covered with psoriasis. But it's not that they have a deficiency in that medication as the root cause. No, there's fire of inflammation burning inside of them. There's a very famous, well-known dermatologist who has since passed away. In 2018, he wrote an article about psoriasis and healing the gut. And he said, the use of these biologic medications without trying to fix the gut is like smoke evacuation without mention of fire.
Wow.
So yes, evacuate the smoke, make the patient breathe easier. Absolutely.
Yeah.
Like use all of the medications that we have. There have been so many advances in the disease state of psoriasis. I sometimes tell the patients, like, you're so fortunate to have this because we have so many more tools today than we had 25 years ago. And,
Yeah.
it's truly revolutionary. But I don't look at any patient as like you're missing this one ingredient in your body. No, like your ancestors and my ancestors, no one had that ingredient. What you have
Yeah.
is a gut that is disordered, and we can block a lot of the signaling and do a lot of smoke evacuation. But once we do that, let's immediately turn to the fire that is burning in the gut. 2,500 years ago, Hippocrates said all disease starts in the gut. And what's interesting is that the genetics that your parents and my parents, that like our parents gave us, the Human Genome Project only elucidated 20,000 gene pairs. But we know as of today, over 44 million gene pairs exist in the human gut microbiome that we know of. And there's a lot of interpersonal variability in that. So most of the diseases that I see are not truly genetic diseases. They're multifactorial diseases. And we have the power through epigenetics. Epigenetics literally means above genetics, to communicate to our genes, both the genes that are inside every single one of our human cells, but the genes that exist in the microbes that exist in our gut, to heal our gut microbiome, then heal the gut lining and make the immune system, which 80% of our immune system exists one cell behind the gut lining, to function for us, not against us.
Yeah.
And so when patients learn that, they feel very empowered. And the nice thing about being a direct pay practice is that rather than looking at patients as like broken, it's like you have psoriasis, you're broken in this way. It's actually, look at how amazing your system is. Your system is so wonderful, but it's alerting you that there is an imbalance, and we have to address that from the inside. And while we also use topical creams and use sunlight therapy and use diet and use all these other things to get you better from a holistic kind of standpoint. And I think a lot of patients appreciate the fact that they leave knowing more about their disease state. They feel empowered to become experts in their individual disease state. I don't ask anybody to become a dermatologist, but I do say,
Yeah.
like, if you have psoriasis, it behooves you to understand what that inflammation means. And both in dermatology and outside of dermatology, people are learning more and more about inflammation. Here in Albuquerque, there's an author and a physician who practices Ayurvedic medicine. So he's an MD trained in allopathic medicine, but then he went to school to become an Ayurvedic medical practitioner as well. And he wrote a book called An Inflammation Nation. And it was about kind of all of the systems that are broken in America and the Ayurvedic approach to that. Now, I don't practice Ayurvedic medicine, but I think that that kind of supports how there's an increasing awareness around this.
Yeah.
We can look at someone like Brian Johnson. Brian Johnson, who is the most studied, he says he's the most measured man in human history, and that he spends $2 million measuring himself. And he has this program called Blueprint. Well, by decreasing the markers of inflammation, he is slowing the aging process. And so we understand that this is inflammaging. And I think that
Yeah.
there is more awareness of this, and that I have patients who have psoriasis who are interested in talking about this. I have patients who come for Botox who are interested in talking about this because they want, whatever interventions we do, they want it to be supported. And I know that if I do a medium depth chemical peel or a deep chemical peel, if I give them the resources to understand how their gut is influencing how their skin is aging, that we're going to get better results with all of our surgical and procedural interventions because we're optimizing them.
Yeah. No, and I think it just shows too how much our bodies work as a whole. I mean, like they're very, very, everything's so integrated, like our gut affects our skin, which is kind of crazy to think about, but I mean, it makes sense that everything in our bodies would be integrated. Like if you move, like I was just in New Mexico for 3 months, and my skin was like, where are we when I
Yeah.
first got there? Because it was just dry, and like I'm sure like my body was dehydrated. Like there were so many other contributing factors to it, like rather than just the environmental change. It was like my whole body was trying to adjust to the new environment, not just my skin.
And you were at elevated altitude as well. And so that changes oxygen
Yeah.
and how your body uses it. It is completely integrated. And I tell patients the way that I practice dermatology in Albuquerque is actually different than what I would be saying if I was in Houston or in Miami. Those are
Yeah.
places that, I mean, all three places are hot, but only one of them is dry. Two of them are humid. And so that
Yeah.
changes how our skin ages and kind of just even like day-to-day routine skin regimens need to change as a result of that.
No, for sure, definitely. And it was so interesting to see, like, so for first person kind of how that aspect of it works as well. And so obviously too, another thing that you brought up is just like the education piece with your patients, and empowering them really with the knowledge that you're sharing with them about the different struggles or things that they're going through, really. And so I think that is so important. And also you talked a little bit too about kind of how they respond to it. So how do they respond to kind of their involvement in their care?
There's a huge, okay, I'm going to change my answer on that one. Let me, that's the good thing about editing. So patients respond in a variety of ways. I have some patients who are very engaged and very empowered, and others who feel like it's a task and they are more looking for like quick fixes or think that there is some magical cure outside of them, and kind of have some resistance accepting that your human body is designed to be in balance, and that balance, when you find it, your skin will be better and all of the other systems will be better as well. I ask my patients, how do you learn best? Because I know after the visit that they are going to go to the web. We live in an age of information. I want to kind of direct them to the resources. And so we keep certain resources in office where patients will sit in a conference room and they will use the very same resources that I used for myself to heal my own inflammation, to reduce weight for myself. Growing up, I had acne. Growing up, I had eczema. In undergrad, medical school, internship, I had seborrheic dermatitis. So I was kind of like, something's off in my system, and I had to figure out how to actually fix it from a root cause perspective and not just with topicals alone. And so they have to give an answer in terms of, I learned by textbook, by cookbook, by short form video, by long form video. And then I give them the resources on that. And I tell them, take out your cell phone, take photos of this, take photos of that. And next time you come in, we're going to talk about X, Y, and Z resource. So it's kind of like homework assignments. And the ones who take that seriously, they come back and they're like, it's been 8 weeks since I've seen you. Without trying, I lost 8 pounds, but all of the 8 pounds came off of my stomach. That kind of thing. And so that's very gratifying for me, that patients are kind of presenting with a problem, but we're solving many problems that they didn't realize that they had. Like, they would go into food coma at 3:30 every afternoon, and they didn't realize that that's abnormal. Food should be energizing to you. It should not be putting you to sleep. And or that if they stop eating earlier in the evening, that their sleep is more restorative. So I tell patients, like, you are what you eat, you are also when you eat. And with these kind of 2 small pieces of information, it's enough for them to kind of get curious about themselves. And that wonder, they start to experiment, and then they start to look for resources to help them. And then I give them other resources to help them. And so that can be very gratifying. So the more engaged the patients, the better the outcomes.
Yeah, no, for sure. That totally makes sense. And that's so cool too. I'm sure, like you said, it's very rewarding to see people kind of taking an interest in their health based off of what you're telling them, because a lot of these people probably, they don't, you don't know what you don't know, and they're not experts in the field. And a lot of people are so busy with just everyday lives that they don't have the time to like look into these things more.
100%. And I tell people, especially the ones who are resistant, I'm like, when you walk in the door, it means you tried to fix this yourself, but you couldn't. If you could have fixed this yourself, you wouldn't be spending your time or your money here. But you walked in the door, so let's just try this. And it kind of gives them a little bit of more encouragement to keep an open mind about things. That's really helpful, because interestingly, in this model, it's like, I want patients to be cured of their illnesses. And when they get cured, they don't need follow-up. It's not like I'm seeing patients back like every month or every 3 months because they are still sick and now they are reliant on medications outside of them. It's like, I want them to totally transform their lives, and that they have kind of respected their system. They've listened to the fact that their system was out of balance. They've made changes, and now all of their systems are working better, not just their skin. And that gives me that leeway of being able to see new patients within 2 weeks.
Yeah, no, definitely. I think that that's great. And do you see kind of more dermatologists or doctors really in general kind of moving to a more integrative model like yours? Because obviously people are talking about it more, like you were mentioning with the inflammaging and anti-aging movement. It's becoming talked about more, but are you seeing it as well in healthcare too?
There's definitely an appetite in dermatology to start addressing root causes. So I'm seeing more of that. In fact, there are training programs that are springing up around it. There's an Integrative Dermatology certificate program. And I know people who have gone through that training and they've spoken wonders about it. I feel like I'm self taught in this way. So I've actually
Yeah.
never gone to obtain that certificate simply because kind of I used myself as my learning experience and now I share that with patients, and I think that patients respond to that kind of personal story, that there's a sense of understanding and also a lack of judgment, that I'm not judging them as being broken. I actually look at them as being highly functional, but that
Yeah.
part of that functionality is that the system speaks to you when it's not doing well. And so I think that there is more of an appetite. I think that at the same time, though, the pendulum will swing the other way, where there are a lot of people who are really resistant to the idea of it. And as soon as you say root causes, they want to roll their eyes and, run out of the room. And that's understandable too. And so I think it behooves patients to continually search for physicians who meet them where they are and who give them the kind of care that they want. Because I fully understand different strokes for different folks, and I'm not everybody's
Mhm.
cup of tea. That's
Yeah.
totally understandable. And, I don't hold myself to that standard of being 100% what everybody wants.
Yeah.
The same is true of other people as well. And they're not going to go down this integrative route with people, and that's fine.
Yeah. No, you're right. It is like everybody needs something different. I mean, just because one thing works for somebody, it doesn't mean it works for somebody else. We're all obviously very unique, and so that requires individualized approaches as well.
Yeah. Yeah.
Yeah, definitely. Well, I would love for you to tell all of my listeners where's the best place to find you on the internet, or where's the best place to find you in general, and then I'll also include that in the show notes as well so everyone can have access to it.
Thank you so much. So the best place to find me on the web is the practice website, sandiaderm.com. Sandia is spelled Sandia for your listeners who are not from New Mexico. The
Yeah.
Sandia Mountains are these kind of magical mountains here in New Mexico that turn bright pink for 5 minutes every day at sunset. And there are a lot of practices in town that are named like Sandia Rheumatology or Sandia Orthopedics, but there was no
Yeah.
Sandia Dermatology. And I thought, I have to trademark that. And you know, that also it was recognition that the focus and the branding of the practice was to honor nature, that
Yeah.
nature has a lot of power in it, and that we can respect that and we can benefit from that. So
Yeah.
sandiaderm.com, and then on Instagram at Sandia Dermatology is the handle. And what I'll do is, you've inspired me since reaching out to me to do this podcast, that I'm going to post these segments from the local NBC affiliate, KOB4.
Okay.
They had me in kind of once a month last year, and I thought, oh, well, this is a great marketing opportunity. They're not charging
Yeah.
me, I'm not charging them, to do a once monthly segment on whatever was newsworthy in dermatology that month. And so there was like Skin Cancer Awareness Month, or there was a product recall around benzoyl peroxide, or there was back to school skincare, kind of hitting different niches and meeting people where they are.
Yeah.
I will start posting more of those clips so that patients can understand kind of my general approach in terms of whole food plant based eating, in terms of supplements, because supplements is a huge unregulated industry. And while supplements
Yeah.
can provide us with benefits, also it's a total wild, wild west in terms of you don't really know what you're getting. And so there has
Yeah.
to be a really important reason to want to take a supplement daily. And maybe it's not taking it daily, maybe it's taking it in only certain times of the year, because your skin needs it at that time. So I will kind of put more of a digital footprint of myself online, and your listeners can find more information in those two resources.
Okay, awesome. Yeah, no, that's great. And like I said, I'll also include them in the show notes too, so then they can just click on them super, super easy. But yeah, no, that's awesome. And yeah, I actually was talking about the supplement industry yesterday, and it's kind of the wild, wild west, like you said.
It is.
Well,
It is.
thank you so, so much for coming on. I really, really appreciate it. And thank you.
Thank you for having me.